It's no secret that almost every pharmaceutical drug on the market has side effects. But one of the side effects that is never discussed is those that can form kidney stones on their own without any outside input. We call these internally the magician stones because they can form out of thin air and are not visible on most medical imaging techniques. Watch this video to get the inside scoop. Hi, I'm Joey Weichman, and welcome to Stone Relief. The public awareness surrounding the consequences of taking pharmaceutical medications is really just starting to pick up momentum as of recently. It wasn't until the plandemic that some of the population began to open their eyes to the evil side of the medical industry. Now, I think that the entire medical pharmaceutical machine is insidious to its core, but that's for another video. My main goal today is to shine light on how many classes of drugs that are commonly in use on the market can cause kidney stones that are invisible to most medical imaging techniques, leading people to suffer without any idea of what's causing their pain, which absolutely drives me mad. Because I genuinely feel for these people and I want to figure this out. And to make matters worse, most doctors and pharmacists have zero clue of the consequences of drugs they prescribe and fill, that they can have these type of consequences for their patients. So when you find yourself in extreme pain that feels like a kidney stone and they can't find anything on traditional medical imaging, most medical professionals just kind of shrug their shoulders and throw more drugs at it, and worse yet, maybe recommend surgery and try to go in and tinker around. And if you're on this channel, you're probably not about any of that. So today, we'll dig into these things a little bit deeper and find out more about stone-forming pharmaceutical drugs and the mechanisms that can trigger them and the actions that you can take. But first, let's better define these magician stones. So when I say a magician stone, I really truly mean that these are stones that can just crystallize out of thin air on their own without any kind of outside input. Now, there's just a few different mechanisms that can go about triggering these things. So I guess there is a little bit of an outside input, but really truly on their own, these stones will crystallize. So things like urine pH are going to play a role. So as we'll see in the next chapter, we'll talk about stones that are urine pH driven. Some crystallize in acidic urine, which is going to be pHs of less than 7, and then some are in alkaline urine, which is going to be a pH of greater than 7. And there's also some that once they reach certain drug like concentrations in your bloodstream, they will just spontaneously crystallize all on their own. So we'll talk more about those in a little bit. But the other thing that's really kind of interesting about these type of stones is they're not really visible on traditional medical imaging. And what I mean by traditional imaging, it's like X-ray and CT scans, which are typically used for kidney stones. Now, you may hear your doctor throw around the terminology radiolucent, which means that, they're not quite visible. Sometimes they'll have a faint little shadowing on like an X-ray or a CT scan, but they pretty much just blend into the surrounding tissues, which makes them incredibly difficult because unless you are going to go through an entire battery of medical imaging to try to figure out this problem, which most doctors aren't going to subject you to, nor do you want to pay for, probably not going to figure out what's happening here. And again, as I alluded to in the intro, they're just going to throw drugs at it, or maybe they're going to try to cut you open and tinker around to find out what the problem is. But there are some different types of medical techniques that can see things, but they come with their own side effects and consequences. So there's something called an enhanced CT that uses contrast dye to use the technology from the CT scan, which is basically, X-rays stitched together in a 3D model to be able to give visibility to the body and different organ structures. And they use a contrast dye to illuminate and separate the bodily tissues from other potentially offending objects like a kidney stone or a drug-based stone. Problem is that those contrast dyes are poisonous to your body. Now, your doctor may say, oh, well, the risk is really not that much and it's fine, but they're not good for you and you shouldn't be doing this unless it's absolutely freaking necessary. Now, some of these different types of stones can be visible on ultrasound, but it takes a really, really skilled technician to be able to spot that stone because even just regular kidney stones are not very easily seen on any kind of an ultrasound. And again, skilled technician, seeing what these things, reading the different shadows from an ultrasound, because I'm not sure if you've ever looked at that, but they sure as hell don't make any sense to me. So it takes a skilled technician to be able to get in there and figure that out. Now, there's also a couple different ways that they can use these contrast dyes to be able to identify with a couple different types of imaging techniques. Now, there's something called a contrast pyrography. Now, this uses the same type of contrast dyes that is going to be seen within like an enhanced CT, but it's a little bit different type of things. this dye is introduced into your bloodstream, and that is what separates these two different types. Whereas the retrograde pyrography does also use contrast dye, but instead it's injected into your urinary tract specifically. So probably better than being injected into the bloodstream, but still it's going to leach out into the bloodstream even if it's injected into your urinary tract. But nevertheless, little bit different techniques that are available, but still these are exceptionally difficult to try to find if you do have this, present in your body. And we're going to talk about it in a little bit in the last chapter about prevention and things that you can do to try to address this, but we'll get there. But next we're going to talk about the stones that form when urine pH parameters are favorable for the crystallization of these drugs. All right, so as I had mentioned, in this chapter we're going to investigate the specific types of drugs that are going to crystallize when urine is either in an alkaline form, which is going to be greater than 7, or in an acidic form, which is less than 7. So the first one we're going to take a look at is an antibiotic, and this is ceftriaxone. And this is going to form in alkaline urine, and they're going to look like this. Now, this is also a little bit blended in with calcium, so you may have some familiar type of look to this. They look very similar to certain subtypes of calcium oxalate stones, in particular the calcium oxalate monohydrate type of stones, if you want to check out our videos on that. So there is some semblance to that because this does bind with a little bit of calcium to kind of give it this type of shape. But they're generally kind of pale in color, and they don't look like a traditional calcium oxalate stone other than their shape and kind of surface that's lent to them. Next, we're going to take a look at an HIV/AIDS drug for somebody who's like already immunocompromised, and this is just kind of adding to an already bad situation. But these are sulfa-based drugs, and these are going to crystallize in acidic urine, so pHs of less than 7, and they're going to look something like this. And they're really distinct because they have this kind of like maroonish, dark red type of hue to it, but they also kind of sort of look like calcium oxalate monohydrate stones, the type 1A and 1B that we've seen in previous videos, but they're going to have this really distinctive kind of reddish color to them that is contributed to by this actual drug itself. So if you're passing something like this and you find yourself on this type of medications and you're trying to figure out what the heck is causing it, it's going to be the drugs that you're taking. And then lastly, triamterene, which is a diuretic that is used for a whole host of things, like predominantly for like cardiovascular type of issues and things like that. But this crystallizes in acidic urine, and it's going to look something like this. And this is unlike any other type of stone that's out there. Very odd, light to dark type of colorations. Honestly, it actually looks like a real stone or a rock to me. But if you're looking and you're passing something like this in your urine and you're taking a diuretic, this is very possibly a consequence of that particular drug. Now, the other piece of this puzzle is triamterene can actually also cause, not only in addition to the actual, their own triamterene type of stone, but it can also cause calcium oxalate kidney stones. Now, there's a caveat to this, just like with every other type of calcium oxalate kidney stone. Calcium oxalate stones will not form without outside sources of oxalate, which are coming from food, predominantly plants, nuts, and seeds, and things like that that you might potentially be consuming. So vacant of those types of outside sources, you're not going to have this medication influence that type of stone unless you have like primary hyperoxaluria, and that is a genetic condition that is exceptionally rare, like unicorn status rare, one in a million type of thing that we've talked about previously. But nevertheless, not super common in that respect. So these are coming from outside oxalate sources by things that you're eating that is being further enhanced by this particular diuretic triamterene. In the next chapter, we're going to take a look at drugs that actually do crystallize upon themselves when they reach certain concentrations.
Just a reminder, this information is available in written form on our website. Find the link below in the description.
All right, so in this last chapter that is with regards to the different triggering mechanisms for these drug-based kidney stones, it's all about certain drug concentrations that are reached in our blood. And for every individual, this is going to be a little bit different. So this is another challenge that comes with this type of stone, that they are just really difficult to pinpoint as far as what concentration levels will actually trigger that formation, that spontaneous crystallization of these drugs. Now, magnesium trisilicate is used for acid reflux disease, and this is going to crystallize into these silicate type of stones, and it's kind of like a whitish, kind of chalky thing, and it looks unlike any other type of kidney stone that's out there. So, there are some other white stones in the calcium phosphate family, in particular like a struvite stone, but those are more like crystally type of appearance. They've almost got a glossy or a glaze type of look to it, where this is very much kind of like a dryish, whitish type of powder, and it's a silicate-based stone. Next are, again, more medications that are in the HIV, AIDS, immunocompromised classification. And if these people haven't suffered enough because of the drugs in that category, that's a travesty on itself. Now they're having to deal with this type of stuff. So this the crystallization mechanism that is associated with indinavir and atazanavir are really truly unknown. They're relatively rare stones, so it hasn't been well studied. So we just know that it can occur when the concentration levels reach a certain point in an individual. And again, it's going to be different from each individual to each individual, like body size, hydration status, a lot of different factors that will go into it. But those stones are going to look somewhat like this. So they look kind of sort of like calcium oxalate type of stones, so it potentially could be confusing to some people if you are immunocompromised and suffering from those conditions and taking these drugs. So it really is important, and we're going to talk about this in the last chapter, to get these stones analyzed to be able to understand the true composition versus just trying to rely on visual analysis alone. But this is what the indinavir stone will look like, kind of flaky kind of crystals there, and atazanavir, it looks very reminiscent of like a calcium oxalate type of stone. So very important to get them analyzed to figure out what it is. Now, I don't have pictures of these last ones, but this is guafenazine and ephedrine. These are typically used within like cough syrups and respiratory type of medications, very commonly prescribed over-the-counter stuff and also pharmaceutical. And this disrupts the delicate potassium-magnesium balance in the body, which then cascades a whole host of other things that kind of get all out of whack, that then lead to the spontaneous crystallization of this particular type of drug into its own stone form. And they are exceptionally rare, unfortunately. So I don't have a really good picture. I've never really even laid eyes on them. So very rare, but it can happen. And if you find yourself taking cough syrups or respiratory medications and suffering from kidney stones, and you haven't had your kidney stone analyzed yet, that once you pass it, better check it out. And again, we're going to dig into that more in this last chapter, so stick around. All right, so we're on the final stretch here. So what can you do and what should you do if you find yourself potentially facing a drug-based stone that may be crystallizing on its own or might be from urine pH? So like I said previously in this last chapter, you got to get these stones analyzed because they look kind of sort of similar to some of the most common type of kidney stones that you might form. But once you start to break them apart and understand their actual composition, it's very, very different. Again, these are pure drug-based stones. Some of them can be combined with other types of stone, like calcium oxalate or just calcium alone, but most of them are just going to be in their pure form. So once we find out what that is, then you can back things up and try to figure out what you could do to try to address these issues, which really is about treating the underlying condition. And with the exception of the HIV, AIDS, immunocompromised type of individuals out there who are taking these drugs because they're life-sustaining, there's not much you can really do in that respect other than keep yourself hydrated to be able to keep fluids passing through your body and through your kidney to be able to stop the concentration levels from occurring that are necessary for these things to spontaneously crystallize. That's why it's important to get at least 3 liters of water, 96 ounces imperial, every single day to be able to flush out your kidneys. And that's just not true with these drug-based stones. That's true with every stone. So when your doctor tells you to drink more water for your kidney stones, he ain't joking. Do it. Drink more water. It is exceptionally important. But for the other things that we have here that we covered off from the drugs, there are some of the things that you should be doing. And again, addressing that underlying condition really is at the root of things. So dietary modifications. So for things like acid reflux, for example, this is not normal. That is your body, it's another feedback mechanism. So it's just like kidney stones telling us, most kidney stones, not the drug-based stones, telling us that you're doing something wrong with your diet predominantly, or even like with the drug-based stones. It's telling you like, don't take that drug, it's not good. It's your body's feedback mechanism. It's saying what you're doing is not good, I don't like it, here. So instead it's like, something can physically slap you in the face. It's giving you acid reflux, or you're getting a kidney stone, or you have joint pain, or you get a headache. Those are feedback mechanisms from your body. It's the only way that it knows how to communicate with us is to cause us some suffering, to get us to maybe question and ponder what the hell that we're doing that's causing these things. So if you're having acid reflux, you got to start taking a look at the things that you're eating. And I'm a huge proponent of an animal-based diet. Initially I started talking about carnivore-based diet, just meat only, but I'm really starting to see some of the benefits as I've started to really get into this book, and I'm about 150 pages into the book that I'm writing, Kidney Stone Secrets, and I'm starting to explore all these different really nooks and crannies of these kidney stones, and I'm starting to understand the importance of things like calcium and citrate. So, dairy products, cheeses, ripe fruits, both of those things are going to give positive contributors to both calcium and also to citrate. They both play protective roles when it comes to all sorts of types of kidney stones. So dietary modifications are absolutely imperative if you're facing any type of stone, and especially if you're taking a drug for a particular health issue. Like, you could fix it with your diet. Like 99% of the things you can fix your diet, but your doctor's never going to tell you that, because guess what? He wants to keep you as a customer for the rest of your life. Don't let him do it. Fix your diet, fix your life. Now, herbal remedies. So if you do find yourself facing some respiratory issue, whether you get a cold or a flu or whatever it might be, or you're using a diuretic to treat some other type of issue, whether it be a kidney stone or a heart issue, things like that, there's no shortage of herbal remedies. And what most people don't know, and what they've done, the pharmaceutical industry in particular has done a really, really aggressive job at trying to cover up, is most of the pharmacological miracle drugs that are out there today existed in herbal form, and then they just took it and enhanced it and synthesized it, patented it, and then sell it to you for thousands and thousands of dollars of dosage in doses. So you really can back that bus up and go back to the source, and not have the negative side effects, and do it for way cheaper. You just have to do a little bit of research. And then lastly, when we're talking about like antibiotics and things like that, we had a video previous to this that talked about like ciprofloxacin is another antibiotic that can also crystallize and cause kidney stones. But there are a whole host of natural antibiotics. Now, there are herbal antibiotics that exist out in nature, and again, that's the kind of source for a lot of the stuff that's on the market today. It's not novel, it's not new, they didn't invent it, they just changed what nature had already given us. And there's also things like colostrum, which is mother's first milk from cows, which are just incredibly rich in just the type of things and the actions that you would want to see in a traditional antibiotic in terms of controlling the immune response of our body favorably when we're faced with any kind of an assault from a bacteria or a virus. So there are certainly things that you can do, just going to take a little bit more research on your part. Are you spending thousands of hours of surgery just to end up with another kidney stone a year later? Learn everything you need to know to say a big you to your kidney stones inside our free community at kidneystones.com.